My name is Lydia. I'm an RN with the SAFE program. One of my first cases, I had some young students. We're obviously in an area that has a lot of colleges around it, and it was actually two girls that came in at once. I was a newer SAFE nurse, and you feel a lot of responsibility. Not only are you learning to care for the actual health of patients, but you now have this legal aspect. You're now learning to collect evidence and writing a report. I feel a heavy responsibility to these patients to provide education on STD prophylaxis, on emergency contraception, about talking about safety planning, making sure they have somewhere safe to go. When patients come in, they're embarrassed and scared. They feel violated. They're in a very vulnerable position. The program's important for the community because there are victims of sexual assault and domestic violence all around us. Not enough people know about the program. I love being a SAFE nurse. I love being able to, I see a lot of young women. I see a lot of young women that look like me, that are my age. I see a lot of young women that resemble my little sister or her friends, and I feel very privileged and very humbled that I get to provide these services to women, because I get to help provide education, I help to provide peace of mind. I feel like I'm always telling people about what I do, and I tell them I'm a forensic nurse, and they're like, okay, what is that? And I get the opportunity to tell them about the SAFE program and all that encompasses with SAFE exams, human trafficking victims, domestic violence. It's in our everyday lives. Surely everyone that I know has someone in their life that, if they weren't directly affected, know someone who was sexually assaulted or is a victim of domestic violence. Whether they're actively in it or it's in their past, it affects everyone around us.